So we just finished a video talking about why BMI and body weight is not necessarily the perfect predictor of health. Now, I'm gonna do the opposite, because BMI is still pretty important for most people. In most cases, it's a predictor of how active you are. So if you're active, your BMI is not actually important, but for most people, their BMI is creeping up because they're not as active as they probably should be. And with decreased activity, you're gonna put on weight. Typically, that weight gain is not going to be in the subcutaneous area, it's gonna be in the visceral fat area, right around the midsection. Visceral fat is very highly inflammatory, and it kind of has a negative feedback on all the other systems in the body. As that inflammation increases, your pancreas and liver get worse at being able to manage your blood sugars. You'll have increasing triglycerides in the blood, which get stuck in your muscle tissue. When those triglycerides get stuck there, it worsens that insulin receptor activity, which then worsens your blood sugar, feeding back on that pancreas liver issue. But there's good news. When you become more active, you actually can more rapidly reduce weight from that really bad visceral fat area compared with subcutaneous fat around the hips and buttocks area. On top of that, we have some pretty good medications that may have a disproportionately potent effect at losing fat from those bad places. All the GLP-1 medications, because of their activity in weight loss and blood sugar control, may improve fat loss from the liver and around the organs a little better than standard caloric restriction. Peptides like tesamorelin are FDA approved for this exact purpose of burning off visceral fat. Storing fat there is also problematic for men because that whole metabolic syndrome is going to result in lower luteinizing hormone levels from the brain. LH, if you recall from other discussions, is what tells the body to make testosterone. So I see this very commonly where a guy has, a wide midsection, they have higher blood sugar levels and lower testosterone levels as a result. Fixing one tends to improve the other and vice versa. So if we can get the testosterone up and get the glucose down, it becomes easier to manage both of those moving forward. For women, estrogen levels are protective against that type of fat storage, which is why, unfortunately, as you go through menopause, you tend to store fat less around the hips and more around that midsection. We do see a little reversal of that in women who go on hormone replacement therapy after menopause or during perimenopause, but this is not the main indication for this. Speak with your own doctor, of course. So even though we have all these different tools at our disposal here, testosterone therapy for men, HRT for women, GLP-1 medications, peptides, all those things, the best thing you can do is still exercise and to refine your diet as cleanly as possible. You want to make sure you're reducing processed carbs and sugars, things like that, increase protein, higher fiber diets, as well as certain kinds of exercise are particularly potent for this. You mix strength training, VO2 max, so higher intensity intervals is a great way to do that one, and some lower level zone 2 style cardio as a foundation. That 3-part program there is very effective at quickly reversing that visceral fat accumulation and all the downstream negative effects that go with it.